Hello, classmates. For this presentation, Talia, Julia, Maricruz, and Laverne will be presenting information regarding Chikungunya virus. This virus has affected humans from the 1952 till present day. My name is Talia, and I will be covering the definition of Chikungunya, the extent of the problem, the agent of Chikungunya. So let's begin. The definition of Chikungunya is a virus that is transmitted by female mosquitoes causing sudden fever, muscle pain, and severe joint pain. Derived from a word in the Chimacondan language meaning to become contorted. According to the World Health Organization, this virus is known to leave its host with joint pain, giving them a stooped appearance. The first outbreak of chikungunya were located in Africa, Asia, Europe, and islands in the Indian and Pacific Ocean. Chikungunya continues to spread within our population, placing thousands of individuals at risk of death. Extent of the problem. An example of the worst epidemic caused by chikungunya was during 2006 in the country of India. 38% of the population in Ahmedabad was affected. While evaluating the graph on the right-hand side, we are able to tell that there was a high level of mortality rates in India during August and September. A total of 2,944 citizens were killed during these months due to the chikungunya virus. This placed a large impact to the Indian population. For instance, the morbidity rate continued throughout the years, averaging 2,500 deaths per month, slowly diminishing the population of India. Agent of chikungunya. As mentioned previously, chikungunya is transmitted through infected female mosquitoes. When a mosquito contacts a host, they provide a viral disease that affects a human's RNA cells. The single-strand RNA virus belongs to the alpha virus genus of the family Togaverdae. Once an infected mosquito contacts its host, the individual's bloodstreams are now infected with chikungunya. Within a couple of hours, the individual's RNA cells will be infected, causing an individual to experience symptoms such as fever, headaches, and joint pain. By looking at the image provided by the National Center Biotechnology, we are able to visually see the structure of an RNA cell strand and its form of development. Once a human experiences these symptoms, the agent has mutated and affected the individual's health.
So my name is Laverne, and I'll be talking about the symptoms, transmission, and the 3 levels of prevention for the virus. So for symptoms, when a person becomes infected by a mosquito, the symptoms frequently begin 3 to 7 days after being bitten. The infected person thus produces immunogenicity, meaning protection against a disease. They are then protected from future infections, so they are less likely to contract the virus again. The most common symptoms of an infected person are fever and joint pain. Other symptoms include headache, muscle pain, and rash. Patients of the virus often feel better within a week, but in some cases, joint pain continue for months. The virus does not often result in death, but symptoms can cause discomfort and severe pain. As for transmission of the virus occurs when an infected mosquito bites a person. The 2 types of mosquito that infect people with the chikungunya virus are Aedes aegypti, Aedes albopictus, and these types of mosquitoes often bite during the daytime. And the chikungunya virus is rarely transmitted from mother to child and through infected blood. So next I'll be talking about the levels of prevention. First I'll be talking about the primary prevention. So the definition of primary prevention is to prevent a disease or injury before it ever occurs. So this means you want to protect yourself before the virus comes into contact with you. So an example of primary prevention would be using like insect repellents, wear clothing that covers most of your skin, avoid areas that are populated with the mosquitoes. Next is the secondary prevention. The definition of secondary prevention is it aims to reduce the impact of a disease or injury that has already occurred. So these are like steps of what you want to do after you have come into contact with the virus. So some examples of secondary prevention would be looking out for any of the symptoms that the Chikungunya virus can cause. You also want to, if you are experiencing symptoms, you also want to get a proper diagnosis from a healthcare provider if you are experiencing the symptoms. So those are secondary prevention examples of what you can do. So the last level of prevention is the tertiary prevention. The tertiary prevention aims to soften the impact of an ongoing illness or injury that has lasting effects. So what kind of prevention you would take when you're going through the virus? So an example of this would be avoid getting more mosquito bites during the first week of illness to reduce the spread of virus to others. This example is important because since there's no vaccines or medicine to prevent and treat the virus, you don't want the virus to spread.
Hi, my name is Julia Hong, and I'll be presenting the following topics: host risk factors, environmental factors, and temporal variation. So, risk factors are variables that can increase one's risk of getting infected or developing a disease. For chikungunya, age and nativity are the main host risk factors, and it affects all race and genders equally. Those who live in or travel to areas experiencing outbreaks are also at high risk for contracting chikungunya. While people of all ages can get chikungunya, adults are more likely to experience severe symptoms and even death. Adults older than 65 and who have underlying medical conditions such as hypertension are candidates for more serious health effects of chikungunya. On this slide, we have a map from the CDC of the countries that have been affected by chikungunya as of April 22, 2016. As you can see, USA, Mexico, parts of Africa, South America, and Asia have experienced chikungunya outbreaks. By visually looking at the map, we can tell that chikungunya is a pandemic worldwide. Now I'm going to be discussing environmental factors. Economic, environment, and education are all factors that can influence one's risk of contracting chikungunya. Those who are of lower socioeconomic status tend to live in poor economic conditions, so their environment can attract mosquitoes. Those who live in areas with active transmission are also more likely to contract chikungunya. People who aren't educated and knowledgeable about the virus can be unaware of the dangers of the disease and not take preventative measures. For example, people can leave out water-filled containers at home, which is an optimal site for female mosquitoes to lay their eggs. Chikungunya cases display seasonal and cyclic trends. Since mosquitoes favor weather with high humidity and heat, cases tend to peak during summertime and decrease during winter. The virus is considered a pandemic-prone disease as it has affected multiple regions in the world. It was first identified in Tanzania in 1952 and has caused periodic outbreaks in Asia and Africa since the 60s. Its outbreaks are often separated into 10-year periods. In 2006, more than 1 million cases of chikungunya were reported in India. Between 2001 and 2011, a number of countries reported chikungunya outbreaks. So on this slide, we have a map from the CDC of the states in the US that reported cases of chikungunya. As of January 12, 2016, 679 cases were reported from 44 states. As you can see, none of the cases were locally transmitted, and they were tied to travel from affected areas outside the US.
Hi, my name is Maricruz Reyes, and I will be talking about the gaps in knowledge on Chikungunya virus. So, we all have known that the virus was first discovered in 1952 in Tarzania. Since then, the Chikungunya virus has continued to develop in Africa and Asia continents. And around 2006, Chikungunya virus was also discovered in the Indian Ocean region, and it has continued to spread. In Europe, there were the first cases reported in 2007. And according to the Centers for Disease Control and Prevention, Chikungunya viruses has been identified in 45 countries throughout the Americas, with more than 1.7 million suspect cases reported by the Pan American Health Organization. There's no actual treatment for this virus. They recommend people, if they have been infected with this virus, to drink antibiotics. But for certain cases, the antibiotics does not work. The reason behind so many unanswered questions is because many countries lack of knowledge towards this virus. Is chikungunya mostly found in South Asia and Africa? The reason why is this virus is mostly found in these areas is because these countries lack of knowledge, and also they don't have the resources to fight against this virus, and most of these people don't even know they have been infected by chikungunya. Search on chikungunya. As we mentioned on the previous slide, there has not been that many research done on chikungunya. One of my theories is that I believe the reason why there's not that many research done on this virus is because this virus is mostly found in countries that are poor. So many pharmaceutical companies don't focus on this virus because they know that the countries that are affected are not able to purchase the pills or the treatment they create because of the lack of sources that these countries have. Researchers need to explain why are people dying from this virus, and also why haven't they found a vaccine that helps protect the people from getting infected. Although in 2005 there has been a phase 1 trial towards chikungunya virus, as we mentioned in 2015, there has been studies done to find a cure and to create a vaccine that helps fight against this virus. According to the Themis Bioscience GmbH, that is based in Vienna, they have funded the study. This is only the third vaccine that they have created, and it has reached the clinical trials. Although they have not found the cure, they are a step closer to creating a new vaccine. There are many reasons why our group deserves the $100 million grant. The money will be used towards the 45 and counting countries to help them control the outbreak of chikungunya. The first thing we would do is focus on the places and countries that are mostly affected by chikungunya. We'll train their community leader, informing them of what are the symptoms of chikungunya, explaining them the difference of this virus, because as we know, chikungunya sometimes is being confused with the Zika virus. Educating the people, we will be decreasing the outbreak of the chikungunya. And also, we will be part of the group that helps find a vaccine to protect people against this virus. These are some of the main points that our group will be focusing on if we
So these
win.
are the references that we used for our presentation. Some of the ones included are the Centers for Disease Control and Prevention, the Institute for Work and Health, and the World Health Organization.